Hi, my name is Huey. I'm doing my remediation video for nasal cannula and a non-rebreather mask. So before we go into our patient, we are gonna prep our stuff. I have gloves, I have gauze, nasal cannula, NRB mask. Okay, we're gonna go ahead and enter patient's room, close curtain for privacy. Introduce ourselves to patient and explain the procedure. Hi sir, my name is Huey. I am going to be your nurse today. Can I have you verify your full name and your date of birth? Verifying patient's information on their wristband. Perfect, thank you. Sir, today the doctor ordered for us to put an NRB and a nasal cannula on you to see if it'll help with your breathing. Okay, so first thing first is we are going to go ahead and perform hand hygiene, and then we are also gonna don our gloves. Okay, and then we will adjust patient's bed to comfortable working height. So for nasal cannula, after we remove it from the package, we are gonna plug it, the tubing into the flow meter behind the patient. Adjust it to the prescribed rate. For nasal cannula, it's usually between 1 to 6 liters per minute. Okay, once that's hooked up, we're gonna make sure the prongs are going down to the patient's nostril. Okay, first thing first, go straight in, and then, go straight in, and then it will wrap around behind the patient's ears. Okay, and then there's a slot down here that you can make it tighter. Okay, perfect. Are you comfortable, sir? Okay, so after putting the nasal cannula on patient and patient's done with treatment, we are going to remove it. So make the slot loose behind the ears. Take it off. We are going to discard this. And then now the doctor wanted the NRB mask. So for the NRB mask, we are gonna go ahead and take the mask out of the bag here, plug it into the flow meter again. We are gonna adjust it to the prescribed rate. It's usually between 10 to 15 liters per minute. We're gonna go ahead and inflate the bag first. Once we have the bag inflated, we're gonna adjust the mask to the patient's face. So tip of the nostril first, and then make sure we have a good seal. Tip of the nostril first, make sure we have a good seal. The bands go behind the head here. And then just to make sure we have a nice snug fit, we're gonna bend the metal piece on top of the ridge of the nose here. Okay, and then make sure patient's comfortable, make sure all the lines are not intertwined or twisted. Okay, once we have that, make sure that we explain to the patient we'll be checking for any skin breakdown every 2 to 4 hours. I'm also going to educate the patient that if I do see any irritations or skin breakdown, we are going to apply gauze pads onto the patient's face here. So first thing first is around the cheeks, and then behind the ears. Same thing on the other side, on the cheek, and then behind the ears. Okay, once patient is completed with their treatment, we will remove the NRB mask. Okay, got the gauze, and from the back here. Okay, remove it from the flow meter, and then we will discard this. We will go ahead and put patient back into a comfortable position, lower the bed down, go ahead and remove our gloves, toss down the proper trash, perform hand hygiene, and we will give them a call light and go ahead and document. Thank you.